Starting in August, students will begin the process of returning to school classrooms across the country. And this is happening in the midst of the ever-evolving COVID pandemic, which is still very much with us. Even as infections are rising again with the many variants popping up, the tools to fight infection are readily available for children of every age. The big question is, how will school systems, parents, and students handle this? Good evening, and welcome to our monthly special edition of The Daily Drum, a collaboration between 96.3 WHUR, HUR Voices, and WHUT-TV. I'm Harold Fisher. We present what parents need to know about childhood vaccines and returning to school. Tonight, you'll hear from several experts who can answer the many questions about this issue. And joining me now for the very first panel is Dr. Laquandra Nesbitt, Director of DC Health, and Dr. Christina Grant, Superintendent for the DC Office of the State Superintendent of Education. I want to thank both of you for joining this conversation.
Thank you for having us.
Dr. Nesbitt, let me first start with you. This is an obvious question. Why is it so important for students to be vaccinated as schools prepare to open?
So, we've made some tremendous gains over, the last 100 years, just to put it extremely bluntly, in terms of being able to improve the health of our population. And that was largely due to a couple of things. One was improving community hygiene and sanitation. The other one was vaccines. Vaccines have done so much to be able to prolong our lives and our livelihoods. And I think people have taken that for granted. Because there are so many infections or vaccine-preventable illnesses that many of us have never seen before, and people have not prioritized getting their children vaccinated as much as they should. In the last couple of years, we've seen many parents maybe delay some of their routine childhood appointments for their children, with missing some of their appointments because of concerns about going into the doctor's office because maybe people with COVID-19 would be in those doctor's offices, and there have been some delays in care. And it's been important for us to communicate to our parents and our families across the district that we're going to need them to get up to date on their routine pediatric immunizations in order for them to attend school so that we don't have the spread of these childhood illnesses that had essentially been eradicated from our society.
Can you compare and contrast the difference for students between now, when there are so many variants, and the early days of the pandemic when there were no vaccines? Are the risks different now?
Sure. So there's two kind of things that we're focusing on. So there are the routine pediatric vaccines that we have for kids, like measles, mumps, rubella, varicella or chickenpox, polio, those types of vaccines. We've seen a decline in the rates of those vaccines for our children, and we need them to get up to date to get caught up on those vaccines. And there's very clear requirements that you have to have your shots for those routine pediatric vaccines in order to go to school. There's the second piece where we have requirements now in the district because of the DC Council action for children to be vaccinated against COVID-19 as soon as a vaccine is fully approved. And that applies for children over 12. Now, we know that if people delay in getting vaccinated for something that allows for the spread of more variants, we now have vaccines available for everyone over COVID-19 vaccines specifically for everyone over the age of 6 months. And so it's extremely important whether there's a COVID-19 vaccine requirement or not for school attendance, that every child over the age of 6 months who's eligible for COVID-19 vaccination get vaccinated. Vaccination is the best way for us to get ahead of these variants.
So, Dr. Grant, so much has changed, as you know, since the early days of the pandemic for the DC public school system. Can you talk to us about how the school system has evolved over the past 2.5 years or so?
Yeah, we're evolving continuously. I would say one, I don't know that any of us have lived through this type of disruption to instructional learning or to the concept of what school was. Now we live in a place that we're calling the new normal. Mm-hmm. So it's March of 2020, we all walked into school one day and then we closed our school system for roughly a year and a half, but school still took place. So teachers quickly pivoted to their homes or living rooms. Every child had a device. We made sure in the district that all of our children had access to technology, because we learned that access to technology was the thing that ensured that our children had access to a quality education. And then our teachers, our leaders, everyone rallied together to get through that year. And then this school year, we opened our school doors. And I'm so thankful to all of our teachers, our leaders, and to the partnership we have with DC Health. Together, we stood up one of the most comprehensive school-wide testing programs in America. We ensured that our schools stayed open. We ensured that we could pivot as the virus pivoted. So when we needed new testing structures, we could stand them up. When we needed to have a classroom closed for a limited amount of time, we issued so much guidance, guidance upon guidance upon guidance, to our principals, our teachers, our families. And I'm grounded in so much gratitude and thanks because they took the journey with us. Our parents knew and understood. This is what September is going to look like. Oh, now we're in December. This is what winter break looks like. And I think we're gathered here today as we endeavor to start next school year even stronger, aligned once again to say it is critically important that our children have access to their routine visits, that they get their shots so that they can come to school. And you know, it's a testament to everyone in Washington, D.C., what we were able to accomplish because we kept our schools open and we kept our children safe. And we know that these visits, these shots, are critical to keeping our children safe as we want to start next school year even stronger. And so we are in our new normal. We're adjusting to our new normal, but we're going to be just fine as we move forward, ensuring that schools stay open, that our kids are learning.
I thought you were about to start a sermon. You said we were gathered
I'm
here
so sorry.
today. No, that's quite all right.
To ensure that the children get their shots.
But you know, with that said, though, this is an ever-evolving situation. So, again, as schools prepare to open, what is your biggest concern now? How do you prepare for the unexpected now?
Well, again, my biggest concern is truly why we're sitting here. We need for our families. Mayor Bowser had given all of our families a homework assignment. We need individuals to stay true to that homework assignment, make their appointments either with their primary care physician or any of the range of providers we have. Our pediatricians, everyone is ready and gathered to meet our children, do their routine visits, and give them their shots. It's a critical step in making sure we start the school year strong. That is one thing that is top of mind. And then the rest of it, in terms of us being able to navigate the unknown, you know, I think history is always a predicator of what we can do in the future. And we've shown that every time a new variant has arrived or there was a new test available or new vaccines became available, we have been able to keep our schools open, keep our children safe, and give our parents the guidance on what they need to do. And today we are saying you need to make sure that you have taken your child to the doctor and that they're up to date on their shots. Because what we don't want, as Dr. Nesbitt alluded to, there is no reason that we would have a measles outbreak in Washington, D.C. That will only occur if we do not maximize the time we have now to go and get our shots and keep our children safe. And so we've rallied together to navigate month after month, and we will continue to do that as we navigate what I'm calling our microscopic enemy called COVID-19.
Right. Now, just for our viewers and listeners, if you can just be really flat-footed and plain-spoken about what parents need to know about the vaccine process. So when school starts, what do they need to have in place? And how will they prove that their child is? And certainly, I'll ask you that, Dr. Graham, but Dr. Nesbitt, you're certainly welcome to chime in.
Well, I'll stick on I'm returning to school, and then I'll let you talk through the process. As plain as can be, if I were talking to my grandma, you need to be able to show that your child has had their shots and that their shots are up to date. Now, we know in the younger grades, they're given out in doses over time. And so what we have done at the end of the school year is reached out to every family and said, based on our records, this is where you are. This is what you have, this is what you need. as families are coming into school, some of the information will already be in our systems, but parents will receive a letter again that says, this is what you need. If they have the form, which is what we're hearing, we're reaching out to families and they're like, oh, we have that. We just have to turn it into the school. And I wish we could have a turn it into the school campaign. Come to the schoolhouse and turn in your paperwork so that we can know that you are in compliance and you can return to school. And I would let you walk through the different series.
Sure. So they, all of our children within 20 days of the start of school are required to submit proof that they are up to date on their routine pediatric vaccines. And we collect that information in two ways. One is there's something called a universal health certificate that is required for children to attend school in the district. And that allows the parents to have their primary care provider, which can be a physician, a nurse practitioner, complete the form and say that this child has had a well child visit. This is proof of all of their age appropriate vaccines. We know that our pre-K3 and pre-K4 learners are probably going to need more things. We have really good rates for most of our sort of like third and fourth graders. And then our high schoolers tend to have lower compliance rates again. So we'll be really focused on, again, those younger learners and those high school learners is where we really have to push parents to get those universal health certificates completed and give us proof of information. There's something else that the parents can do in addition to if they haven't been to their healthcare provider yet. They can have their healthcare provider just send us information about their shot records, right? I know some of us, I still have my shot records. I carry them around with me.
Yeah, so do I.
So some family members, some parents may simply just have the shot record at home and they can drop that off at the school. And that will help us understand that maybe there's something missing from our registry, our database, where the child has already had their shots. But we just don't have that on file. So those are the real actions that parents need to take. They need to take the child for a visit, get them up to date on their shots, get the universal health certificate completed, bring it to us, or send us their shot record if they believe their child is already up to date. Most vaccines are given to children who are between the ages of 4 and 6. And so parents who have children who are between the ages of 4 and 6 are probably going to need to get their kids more shots than children who are a little bit older. There are some additional vaccines that are given between 11 and 12, like your HPV, some boosters of the chickenpox shots, those types of things. And then those we notice tend to be missing as children go from middle school and up. So we'll be, again, as Dr. Grant has mentioned, we've started sending information out before children ended the last school year. We've been doing phone calls to parents' homes, all of those things to make sure they know exactly what they need to keep their children in school and to prevent outbreaks of any kind from happening throughout the school year.
But Dr. Grant, what happens if, for whatever reason, a student is not up to date with their COVID shots? They come to school on the first day and either they don't have the information or they are not vaccinated. What happens?
So on the first day of school, we will receive notice. Families will get a letter home acknowledging where they are regarding all of their shots, COVID and the routine immunizations that we're discussing. Within 20 days of the first day of school, children will have to come into compliance or they will not be allowed to return to school until they come into compliance. And so we are here today because we want to ensure that families understand what does it mean to come into compliance. It is either get your routines done, make sure we have your information, bring in your shot record, and that is true for children with respect to COVID-19 for children ages 12 and up. So they too will have to have had their vaccine or booster series, depending on the age of the child, to ensure that they can remain in school.
And there are plenty of opportunities that we have right now to support families and community. We've been partnering with a lot of our community health providers, our community health centers. Our school-based health centers are open for families who may not have a primary care provider or regular doctor that they see, or if they're having trouble getting an appointment with their regular doctor's office, they can come into any of our school-based health centers. We're seeing any child who's over the age of 4 to schedule an appointment Department. We're also working with a lot of our health centers to offer some mobile clinics around the city, and those will be ongoing through the end of September, as well as working with any school. So our DC public schools, public charter schools, private schools and parochial schools can request through the health department through something we call the vaccine exchange to host a clinic on site at their school to help their children and children get vaccinated. So this is so critically important to us, right? Our goal here is to keep children in school and to make sure that they have all their opportunities to learn. We know how much being in the classroom is important, not only for the academic components, but for their social and emotional development. And we want to have our families have every opportunity they can to be in the classroom. But we also have to take very seriously our responsibility to prevent any outbreaks of any kind of these vaccine preventable illnesses. So we're going to do all we can between now and the first 20 days of school to get all of our children up to date on our part. Working together, DC Health, the State Superintendent of Education, all of our public school partners and private and parochial school partners to make that happen. And we're grateful to you today to give us the opportunity to share all this information with our children and families in DC.
Well, thank you for that, because we know just how difficult and I think quite frankly dangerous things were in the beginning of the pandemic, not just for young people, but for the seniors, the grandparents, the aunts, the uncles, the parents even, who may have been considerably more vulnerable before there was a vaccine, when everyone was just kind of running around trying to figure this new issue out. And so now, here we are where I would argue there were many more people on board, but Dr. Grant, what do you do with parents who are still giving pushback about the vaccine? They don't want to get it. They don't want their children to get it. The irony may be that their children may already be vaccinated for measles, mumps, rubella, and all of these other kinds of things. But I'm sure there still is, if not a large amount of skepticism, there are still some people who are just no vaccine. How is the school system prepared to deal with those students?
Well, first I want to say and acknowledge that vaccines are safe, and they are a critical core component of staying healthy, keeping the district safe, protecting grandma. It's all interconnected. And so I just think it's important to note that the vaccines are safe, they have proven to be effective, and they are our first line of defense against COVID-19. And you spoke about where we were some 2 years ago, and we should remind ourselves that we were in our homes. We couldn't freely move throughout community. We couldn't see grandma. And now we have a vaccine. We have several vaccines that are safe, reliable, completely free, and accessible. And so I would encourage, we have been encouraging families who still have questions to engage with the health community. Sit with your primary care physician. Engage in a conversation. Have your questions answered by trusted sources so that you can make an informed decision. But our city council has passed a law that says that children age 12 and up must have the COVID-19 vaccine to attend school in Washington, D.C. And so it is our efforts to make that come to pass. And so everything that Dr. Nesbitt has framed around access to the vaccine, access to healthcare providers, that is all in an effort to ensure that our children are able to be vaccinated from COVID-19, return to school in the fall, and be ready to learn. And so that's the line that we have to walk as a community, and it is to keep the community safe. We cannot go back to where we were 2 years ago, and we have to keep our children in school. We know it is not just the place that they learn, it is the safest place for our children. Even if you think about the disproportionate effect of the pandemic on Black and brown children, our children need to be in school with their teachers, trusted adults, not just learning, but being educated as a whole child. And so that's the line that parents are going to have to walk. That's the line that we've all walked when we took our shot, and we encourage our parents to model for their children and make sure that they get their shot as well.
I did want to have you drill down just a little bit more about that very point, because we've seen school systems across the country where students have been learning from home, and there has been a disparity between more affluent communities where there have been, high-speed Wi-Fi and all of that in internet, and then, communities that are more challenged. Talk to me a little bit more about why it is so important for them to be in school right now, because to be quite honest, and you can correct me on this, this really is this coming year, the 2022 fall to 2023. This is really the first full year that they will be back in school. Is that correct?
No, so our school year completely started and opened and operated fully last school year.
Okay.
We were managing the realities of the pandemic, but our school doors opened in September and they remained open the entire year. And you see Dr. Nesbitt nodding so
proudly.
Right, yeah, right. So,
in her words, we will stand on that, that our school system, and it is a testament again to Washington, D.C. That is not true for all jurisdictions across the country. We opened our schools, we kept them open, we kept our children learning. But to your point, the 22-23 school year is critically important because we've navigated so much.
Right.
We understand virtual learning, hybrid learning. We know all the different ways we will have to flex should anything occur. We do not have to experience full instructional disruption again. We know that in Washington, D.C. A critical component of it is, now that we know it, we know the best place for a child to be is in a classroom with their teacher. The teachers know it, the students know it, and parents know it, because when we opened those doors in September, the first thing we saw were parents pulling up to the school like, "Hey y'all, so good to see you, here you go." Because I think there was a false assumption before the pandemic that they were like, "Oh, school," and there was a question after that. And now in DC and across America, people are like, school. Mm-hmm. School is critically important. It is more than where you read and write and learn to do math. It is where children are making decisions about who they will become, what type of citizens will they be, how do they contribute to this great thing called democracy. And that starts with childhood immunizations, which again, Dr. Nesbitt said, it's been on law in DC since the 70s.
Yeah.
These vaccines have existed for decades, and now we all just have to do our part to keep the doors open and keep our children learning, because that's how we ensure that all of our learners have a fair shot and that these gaps in learning no longer exist or continue to be closed.
I'm going to take a break in just a bit, but in these last few minutes, I wanted to give both of you an opportunity to just share some final thoughts about where you are individually as we look at opening school and just how far we've come, Dr. Nesbitt.
Yeah, sure. We've really embraced a focus on equity, both from a health equity perspective, racial equity, social equity perspective here in the District of Columbia. And for me, it's extremely important that we have all of our families, in particular our Black and brown families in the District of Columbia, doing everything that they can, and us getting all of the resources and that we can to them to help them get their children vaccinated, for their children to become vaccinated. This can be one of the great equalizers in terms of improving health outcomes for our population, right? These are preventable illnesses that we can completely eradicate these diseases from our community. And so the vaccines are safe and effective. They can help prevent the spread from more vulnerable individuals who will have a more complicated course of disease and more long-lasting complications if those persons were to be infected. And so to me, it's been very important for us to make sure that everyone who can access these free vaccines absolutely does so, and for us to put them in all of the places for people to be able to get them conveniently. And so we're doing all that we can to make that happen. And in turn, our children are able to take advantage of being able to go to school, accessing their education, which is an absolute right for them to be able to do, and to not have any disruption in their in-person learning and continuing to promote their social and emotional development. And then that one day they'll be able to take my job and Dr. Grant's job, you know, and be future leaders in our community. I think people underplay why this is so important in the grand scheme of things. And these things are all, as Dr. Grant mentioned before, they're also intimately connected.
Dr. Grant, a quick word from you.
You know, I'm so excited about the start of this coming school year. And obviously, I'm an educator at heart, but we all get excited in August and September. It's like our Super Bowl, right? And so, you know, we're running the play, and teachers right now, teachers are at Staples and they're writing lesson plans. And when I think about parents, they have their little list of all the things that they need to do to start school. Children are excited about their new clothes or uniforms. And we just are saying, add to the list, take your child to the doctor and make sure they have this health visit. And the health visit is for the vaccine, but it also frames for a child at a very young age that you should go to the doctor and you should engage with the health community, and that doctors are safe and shots are safe. And this is a part of your process of getting ready to go to school, to start your new school year. And so I'm excited about what we will accomplish for the 2022-23 school year, and do again want to thank our teachers, our principals, anyone that is serving in the life of a child. A tremendous thank you. You've navigated so much, and I know the best is yet to come, but it does start with these visits.
Okay. Dr. Nesbitt, Dr. Grant, thank you both for talking to me. I really appreciate it. And let us hope for a successful school year as we move into this fall.
Thank you.
Thank you
for having us.
What parents need to know about childhood vaccines and returning to school will continue in just a few seconds. Thanks for staying with us. Our special edition of the Daily Drum, What Parents Need to Know About Childhood Vaccines and Returning to School, now continues. Joining me now are pediatrician and public health expert Dr. Laquandra Hancock, Dr. Damika Walker, chair of Immunize DC, and Dr. Habib Shariat, pediatrician with Howard University Hospital. Thank you all so much for joining this conversation. Dr. Hancock, I want to start with you. Let's talk about some of the latest vaccine developments. A few weeks ago, the CDC approved vaccinations for children under 5. Just last week, the 2-dose Novavax vaccine was approved for adults. How would you characterize these two developments as schools prepare to open?
I'm very excited, particularly for the vaccine approval for children under the age of 5. We know that parents have been chomping at the bit to get their children under the age of 5 vaccinated. When we look at the numbers back in January with the Omicron variant, we saw that children between the ages of 0 to 4 were disproportionately hospitalized compared to any other age group among pediatric patients. We also know that the Omicron variant specifically impacted the younger children because their air tubes, their bronchi, are much smaller than adults. And Omicron predominantly infects the upper airway. They had more severe symptoms. And parents want to do whatever they can to protect their children, not only from COVID, but from having severe illness. With this new vaccine, it's exciting that we have yet another option, especially for families that are a bit concerned about the mRNA vaccine. I know that for a lot of my families, that was one of their biggest concerns, with that this is the latest and newest technology, and so I don't necessarily want my child to get this vaccine. The alternative was Johnson & Johnson, which was not available in this country for children. So the fact that we have an additional vaccine as an option gives them some more support in terms of making that decision, particularly for their older children with this latest vaccine.
Dr. Habib, talk to me a little bit about what child vaccines are and what diseases do they prevent. And I'm talking about more broadly, not about so much COVID, but we can discuss that obviously, but just child vaccines in general. You know, Dr. Hancock just mentioned, MMR, measles, mumps, rubella. Forgive me, I'm still working on my medical degree, but measles, mumps, rubella. What do parents need to know about that?
In general, vaccines are biological preparation, and depending on what type of vaccine we're talking about, it can contain either whole, live, weakened, live, or inactive killed vaccine, or for the most part, majority of our vaccines are what we call subunit vaccine, which are genetic material, sometimes only protein, fraction of a protein that is present in the disease-causing bacteria or viruses. They are not taking it from those. Most of them are bioengineered in the pharmaceutical industry and would be given as a vaccine. So the role is for this vaccine to, when we administer it to the recipient, the immune system would recognize these particles, these subunits, these substances, these proteins, and get familiar with it. So when similar protein, which is present in the bacteria or viruses, enters the body, this time as a whole, a live, wild bacteria or virus, or their immune system knows this particle and immediately responds to that by mounting antibody and fighting and controlling the infections.
How long does it take, for example, for measles or mumps or rubella vaccination to begin working, and how long might it last for young children? Because I remember when my daughter, who is now an adult, going through this process when she was very, very young. Is this a lifelong thing, or does it need to be boosted, for lack of a better term?
So that's what I mentioned. There are different types of vaccines we have. We have live vaccine, which are weakened, attenuated vaccine. These live vaccines, it works exactly like the wild infection in the nature, but it's a controlled infection that is being carried out. In these cases, 2 or 3 days after they receive this vaccine, they will have, some of them, not everybody, some of them would have a mild infection, low-grade fever, which lasts for a couple of days and it goes away in a week or so. And by the end of second week, they are usually have good immune response to that live agent, which lasts theoretically for their lifetime. It's just like getting the infection once and you're immune to it for the rest of your life. On the other hand, there are other vaccines that I mentioned to inactivated or killed or subunit vaccine. These vaccines depends on the amount that we inject to the recipient, and the immune system, usually the first administration, recognize it and mount some antibody. These vaccines requires multiple doses. That's why you see we have diphtheria, tetanus, cellular pertussis vaccine at 2 months, 4 months, 6 months, and then at 15 to 18 months, and then at 4 to 6 years, and then 10 to 11 years. So they require boosting doses to be repeated over time to prolong the immune response that is immune system has produced against these agents.
Dr. Walker, let's talk about Immunize DC, your role and its mission.
Sure. So the mission is pretty much just to continue to be able to develop patients over the lifetime. So we want to see children that are getting vaccinated at a young age over the lifespan to really advocate for vaccinations to prevent these diseases that can be prevented with vaccines. So pretty much our mission is to work with different partners in the district, from doctors' offices to OSCE to pharmacies, and really just to advocate and work together so that we can make sure to educate the district residents to make sure they are aware of what vaccines they need and also where they can get these vaccines to really help to prevent these diseases.
Talk to me about some of the challenges that your organization has had to deal with during the pandemic.
Sure. So the main, of course, with the pandemic, people aren't going anywhere, right? They don't want to go to their doctor's offices. We had a really hard time, or we definitely saw a decrease, of course, in children getting vaccinated. So the hardest part that we saw as a coalition is trying to figure out how we can work with different healthcare professionals, different organizations to still advocate for parents going and making sure that their children are still getting vaccinated. It was a very sharp decline. And so as a coalition, our job was to figure out how we can work with our partners to make sure that we are still educating people and enforcing the importance of making sure that they're still making sure to see their pediatricians and make sure that they're up to date on their vaccinations.
Have you seen any improvement since the pandemic has evolved over the past 2.5 years?
Definitely seen some improvement. One of the things being that now that pharmacists can vaccinate as young as 3, it opened up an opportunity so that parents could also take their children to pharmacies to get vaccinated, which is a little bit more accessible than sometimes being able to make an appointment with their pediatrician. So definitely with them having that opportunity to take advantage of that, as well as people becoming more comfortable with learning how to live with COVID, as they say, we have been doing a better job of making sure that we can reach out and make sure that children are getting vaccinated.
Dr. Hancock, in your pediatric practice, what impacts have you seen on the patients regarding these new variants? Have you seen any change at all?
What I would say is the change that I have seen is parental trust in vaccines, given the fact that in real time, this is probably the first time in our society where lay public has been part of the journey of vaccine development, testing, and implementation. And because there have been changes and pivots as we have navigated through the COVID-19 pandemic, where the CDC says don't wear a mask, put your t-shirt on your face, put any old mask on your face, then go get an N95, it has facilitated a level of distrust within the CDC, a level of distrust to the point where it is now impacting my ability as a pediatrician to talk families through getting vaccinated. And I think it's important in the medical community that we acknowledge that distrust, that we help parents in terms of us recognizing it, number one, and then talking them through. You know, when we were talking earlier, I said sometimes it's a challenge because families see us as having drank the Kool-Aid, right? We're part of the system. Clearly you are a Western trained doctor and da-da-da-da. I hear it often. I'm also a mother. And so I often ask my parents, do you think I would recommend for you something that I wouldn't do for my own child? My child is fully vaccinated at 9 years old. I went through in medical school and in pediatric training, they didn't teach us the ingredients of the vaccines. They taught us why they were used, the purpose of them, that they decrease morbidity, which is a complication from having certain infections, and mortality, death from infections like Haemophilus influenza, polio, the fact that we just had a case in New York, first time in 10 years, right? So it's talking them through what my own experience was in making the decision to get the vaccine, get all the vaccines for my daughter, so that I can tell them what are the ingredients in these vaccines. And a lot of the ingredients that families are concerned about are the same ingredients in their pots, the same ingredients in the ice cream, even worse ingredients in a bag of potato chips, right? So it's talking them through, first acknowledging the distrust that they may have with the system right now, but talking them through to a point where they can make an informed decision without having to do their own research, right? So they come in with their information. I ask them, tell me what websites you're going to. Is it www.wedon'tvax.com? Or is it a trusted site? So that I can vet it, look through it, and then we can talk through, okay, this person was, connected to Andrew Wakefield, who was the one who misrepresented data to falsify the information that links autism to shots. That's this person subscribes to his way of thinking. He is his #1 fan. So pay attention to where you're getting your information. And from doing all of that, I have been able to talk families through making the decision, not talking them into, there's a difference, talking them through making the decision for themselves. And I've had to do that more in 2022 than I have had to in almost 20 years of being a pediatrician.
Why more this year than perhaps in last year?
Because I think prior to COVID, the parents I dealt with most who were opposed to getting vaccines were truly anti-vaxxers. They subscribed to conspiracy theories about population control and infertility and all of these things that we know are not true when it comes to vaccines. But when it came to navigating through the pandemic, because there were so many pivots, literally science was happening in front of all of us. And because of a lack of health literacy and science literacy, we did not collectively understand why the CDC had to make changes in terms of their recommendations, why we need to get a first booster and a second booster. It's because if you did not take an immunology class like last year, even for some of us clinicians, we need a refresher to have a clear understanding of why a booster is needed. So if some of us don't understand it, how are we to expect that mommies and daddies around the country are going to do the same?
Dr. Chariot, to Dr. Hancock's point, even just about the vaccines that we know have been around, that have been proven, and yet I'm sure that you, in your practice, encounter anti-vaxxers, particularly as it relates to people who are concerned about autism. Talk to me about that, and what do you tell your patients or the parents of your patients? What are those conversations like?
So the issue is vaccines are being monitored continuously by the CDC, by the FDA, and federal government and authorities that monitor any mishap that happens with the vaccine. And the issue of a relation between some of these vaccines and autism came about. National Academy of Medicine, formerly was Institute of Medicine, decided and put the experts on board to review all the data that is out there linking any of these vaccines to the autism. There had not been any evidence supporting such a relationship, both with the active ingredient of the vaccine in case of measles vaccine, the measles virus, and also with the other ingredient, which is like we have preservative, like they used to be, we don't have it anymore. In almost 99% of our vaccine, we do not have mercury containing or thimerosal, which use some of these sites. We're attributing that heavy mercury being the link between vaccines and autism, and specifically this item were reviewed by FDA, by the Institute of Medicine, National Academy of Medicine, and there were no links whatsoever between any of these things, and evidence actually suggested that that these vaccines are safe. And although even before this issue came up, vaccine manufacturer decidedly removed all thimerosal containing vaccine before year 2000. And these days there may be only one or two manufacturers of flu vaccine that may have mercury in them. For the most part, all the vaccines that are other vaccine other than influenza vaccine that are for children are free of thimerosal, mercury, and any other heavy metal that could be causing any problem.
Dr. Walker, moving forward, again, as we've seen the pandemic evolve into new challenges and some victories, where do you see your role in your organization moving forward, not just in 2022, but beyond? Because it appears that COVID, in some form or another, is going to continue to be with us.
Absolutely. So I definitely think with the coalition, our main thing is just making sure that we provide that platform so that people can have information, the right information to make informed decisions. As they were saying, it's not our job to force vaccines. It's our job, though, to provide the correct information so that people are informed. So definitely for us going forward, our main thing is to make sure that we use platforms like this and be able to have those conversations to provide the right resources to parents, and not just parents, but also to other healthcare professionals, and making sure that we collaborate together. I'm a pharmacist, so being able to collaborate with medical doctors and making sure that everybody knows what resources are available so that we really can help the district residents. So for us as a coalition, definitely going forward, our job is to make sure that we keep having these conversations, and most important, just providing those resources so that people are informed and that they can make the best decision using credible resources, should I say, or credible information, because we know there's a lot of mis and disinformation that is being circulated.
Are those conversations difficult?
It depends. I think it helps, though, when you form those relationships and people have that trust. So really forming those relationships, and that's why we have such a very diverse group of partners that we work with, because we know everybody has different touch points, and being able to have those conversations with people that they trust, it looks a little different. So that's why we have, like I said, pharmacists, we have pharma, we have doctors' offices, pharmacies, everybody working together, because I think when people see people that they know and that they trust, it helps to get the point across stronger than just coming from just any and everybody.
Dr. Hancock, we know the acronym, was it MMR? Mm-hmm. Do you see a time when there will be an MMRC, measles, mumps, rubella, COVID? Because, as I just said, it appears, and you're the doctor, You're the doctors. But just anecdotally, this thing is not going away. It may continue to evolve. It will continue to develop new variants with various and sundry levels of infection rates. So do you think there may be a time when you may be bringing little Johnny or little Susie in, not only for measles, mumps, rubella, but also measles, mumps, rubella, COVID, instead of dealing with COVID separately?
Absolutely. When we think about the scheduled vaccines, right? So little ones start getting their vaccines as early as first or second day of life. They get their first hepatitis B. Next set of shots is 2 months, 4 months, 6 months, and then 12 months, and either 15 or 18 months, and then 4 years and 11, and then as adolescence. COVID will be part of that series. There's a process that the CDC goes through to decide what is going to be part of a scheduled vaccine series. And I wanted to make sure that I add in terms of the question that you asked about autism, it's important for people to understand over 1 million children have now been studied. Over 1 million children have been studied to determine whether or not there's a relationship between autism and vaccines. And the resounding evidence is that there is no relationship. We have been in the vaccine space since the 1700s when smallpox vaccine first came about. DTaP has been around since the early 1900s. So these vaccines collectively aren't new, and generations of us have received them. And absolutely, will there be a COVID vaccine as part of this series? Yes. What's going to be required is that we control our numbers. We won't be able to appreciate the seasonality of COVID until transmission comes down, in the same way we do for flu. We know flu season is somewhere around September, ends around March or April, depending on whether or not you're wearing your mask, right? We enjoyed a whole almost free flu season when we had our masks on. Once we get the numbers down, and prayerfully we will be able to appreciate seasonality. Once that happens, then we will likely put COVID with a flu shot in order for us to be protected through the COVID season, if you will. And that's what I anticipate seeing if we can get our numbers down.
Mm-hmm. Actually, Novavax announced 2 weeks ago that they are working, actually they're working on a flu COVID vaccine for this coming fall. So how far they are away with the manufacturing and all those things, but it is possible, and it is going to be on the horizon, and it will come sooner before.
And hopefully it'll be based on Omicron and not original COVID, because it's almost a waste of time to create vaccine based on OG COVID. That's why there's a delay. There's a potential delay in the second booster being rolled out for particularly people under the age of 50. Right now, there's a conversation in the FDA to delay 50 under getting the booster until the mRNA vaccine producers can provide us with a variant-specific vaccine so that we're not just getting boosted for boosting's sake.
There's something that just occurred to me, and this goes to the very heart of dealing with confusion with vaccines. Okay, when you go and get a measles vaccine, you go and get your rubella, you go and get mumps. I would argue that parents don't know who the manufacturer is. You just go get your measles shot. You go get your mumps shot. You get your rubella shot. But with COVID, because as Dr. Hancock said, this science was happening in front of us. And there's so much information out there. And so do we need to get to a point where it doesn't matter whether it's Pfizer or Moderna or Johnson & Johnson or Novavax in the scenario of a measles, mumps, rubella, COVID? Do you think that knowing who is manufacturing this is confusing or problematic for parents?
Well, you're right. In the past, for the childhood immunization vaccines, no parents were concerned, but you're asking us what kind of vaccine we are administering them. Whatever vaccine we had, we will offer it based on the ingredient, not who's making it, how's making it. Because in the United States has the safest, most effective supply chain of the vaccine production. This is the true fact. And these manufacturers are bound by rigorous monitoring by the CDC and FDA in their production line. Almost no vaccine is being imported from outside into the United States. So all the manufacturing facilities are here. Mm-hmm. So the only time that this issue of who's making what came up with this pandemic, and truly it was an emergency, Many suppliers had to come into the thing. Some of them went through a couple of months of production and then they stopped it. And that's how parents were informed almost on the daily basis on what is happening with the vaccine production. And that's how some antenna went up with whose vaccine is better, whose vaccine is more effective. All these vaccines are effective, that is for sure. All of them have passed the rigorous safety paradigm that the CDC and FDA had put forward on them. So parents really should be assured that the vaccines are safe, and the question is for them to make a decision to get their kids vaccinated.
Dr. Walker, how do you address that question to parents or even loquacious children? You know, what brand? I want this brand. I don't want that brand. What is that conversation like?
Absolutely. So it comes up all the time. Of course, parents want to know, which one do we have? Do you have Pfizer? Or I only want to do Moderna because it's only 2 doses and Pfizer's 3 doses. So it's a great thing that they have the information out, but it does sometimes cause them to pit against one vaccine or the other. So the conversation I always have with them is just to echo, what was just said. All of them are safe, all of them are effective. The most important thing is making sure you get your child vaccinated. So always get them vaccinated with what's available versus waiting to get a certain vaccine because you just want a certain manufacturer. Because then that obviously just exposes your child. That limits the amount of time that you have to protect them because you just want a certain manufacturer. So always encourage them. The most important thing is to get them vaccinated, more so than just to wait on a certain one to suit your preference.
This is just a reminder that this is a special edition of the Daily Drum, what parents need to know about childhood vaccines and returning to school. I do have a question that I think we don't hear a lot about, and I'll ask you this, Dr. Hancock. What about side effects? What should parents look for when their children are receiving the vaccine?
It's an excellent question. First thing that's important to note is the difference between a side effect and an adverse outcome. A side effect is something that we sort of expect to happen after you've gotten a shot or taken a medicine, right? If you take diphenhydramine, also known as Benadryl, you might get drowsy. Those are the things that we anticipate. When the child gets a vaccine, they're going to have some arm soreness. That's a side effect. They may even have slight fever. That's a side effect. They may have some tenderness at the site of injection. That's a side effect. But if they have a temp up to 106, which can sometimes be associated with the vaccine DTaP, that's an adverse outcome. If they have a severe allergic reaction, that's an adverse outcome. We've seen a couple of adverse outcomes with COVID-19, particularly myocarditis or inflammation of the heart muscle among adolescent patients with the mRNA vaccines. Those are adverse outcomes. So I talk with families about what side effects to anticipate. A little bit of fever, a little bit of fussiness, a little achiness. Massage through when they get the vaccine, rub those little thighs so the medicine doesn't sit in their legs. Give them a little bit of a fever reducer, pain reliever, so that it helps navigate them through, so that they can anticipate what's going to happen. We also talk about adverse outcomes that may be associated with it. And to Dr. Habib's point, in terms of vaccine safety, there was a vaccine, the meningococcal vaccine, when about 2 years into my practice, it was associated with Guillain-Barré. The reason why we were able to note that was that we reported it out. There's a system called Vaccine Adverse Event Reporting System that all healthcare providers are required to report in when there is a concerning adverse outcome. Because we had reported in this Guillain-Barré, which is an inflammation within the neurological system, a red flag went up. And within a couple of months, it was like, oh, wait, pull it off the market. It was pulled off the market, reformulated, put back on the market after extensive testing, and we've not had any issues since then. So it shows the system works. But it also helps us to know we get alerts all the time through email of what to look out for. And then we make sure we communicate that to our families.
I want to allow each of you to just give me a final thought of 30 seconds each. Dr. Walker, I'll start with you. Your final thoughts about this conversation.
One, I'm glad that this conversation is happening. It's very important that parents are aware, parents are informed, parents are really just making the best decision for their children. I am a mom, so I can understand the questions that arise, but it's really important to make sure that we are all doing our part to make sure that we keep our children vaccinated, keep them safe, especially for those people who cannot get vaccinated. It helps to keep them safe as well. So continue to have these conversations, continue to ask questions, because that is what helps to make those informed decisions. So I'm definitely glad this platform was available. Continue to utilize all the resources that are out there with DC Health, with OSSI, Immunize DC. Our platform as well has resources, so just continue to stay informed and continue to keep your baby safe.
Briefly, Dr. Shariat.
Well, I think we have had the vaccine, COVID vaccine for children since November of last year. I am concerned about the lack of enthusiasm, as I would like to see in African American community, to bring their kids for COVID vaccination. And this is a very timely, the school is going to start. This is the time, because the vaccine that is the only way to keep us safe, to keep us outside the hospital, to keep us from really tremendous pain and suffering that COVID can cause. Children have been doing fine, but remember, we have had 400 children dying of COVID vaccine, most of them younger than 4 years of age. So the vaccine now is out there for 6 months and older. I encourage the parents to take action and bring their children for immunization.
Dr. Hancock, briefly, final thought.
Sure. I would tell parents to not let fear be what drives your decisions in terms of the care of your child. Connect with a trusted medical source that has no bias when it comes to making these decisions, and share what sources you are using with your healthcare professional so that you can talk through making the right decision for your child. Because as you mentioned, particularly for children of color, we will be disproportionately impacted if we lose herd immunity with these preventable diseases.
Thank you all so much. I really appreciate your input. And finally tonight, it has been a long and very difficult 2.5 years of the COVID pandemic. And it has evolved, but it is still with us. We have also evolved in order that we find some semblance of normalcy. Well, no matter how you may feel about vaccines for yourself or your children, remember this: COVID has no feelings, and it appears that it will continue to impact our lives for many years to come. To stay safe, we will continue to evolve to survive it. I'm Harold Fisher. Thank you for watching and listening. Good night.
This program was produced by WHUT and made possible by contributions from viewers like you. For more information on this program or any other program, please visit our website at WHUT.org. Thank you.